Welcome to Healthy Lifestyle with Lori Anne. I am Lori Anne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. Welcome to the show. I hope you all are having a wonderful day. I know I am, but I always have a good day. We are here today with Margaret Hill. She is an RN, Infection Prevention Program Director and Quality Management at Syosset Hospital of the Northwell system. She has always wanted to be a nurse as long as she could remember. Her mom became a nurse when she was in elementary school, and she was really proud of her mom. She wanted to be just like her and help people. And she's had a very diverse career, starting out at LIJ, working in long-term care. And she's worked as a nurse in a school and then went back to Long Island J and was totally in love with what she did. And I love people who love what they do because I love what I do. And it's real important to love what you do, especially when you're helping other people. So she became a manager on the original floor that she started on South North, and then an infection preventionalist, an IP. And she worked at LIJ and the Cohen's Children's Medical Center for 7 years until she started her current position at the Syosset Hospital. So all of her previous work has prepared her for her current position, and she really loves being an IP, an infection preventionist. And I want to talk more about that name. That's not always so easy to say, right, Michael?
Yeah, no, definitely not. I could get tongue twisted.
Especially on this beautiful day. So we are back in. Anyway, so I want to invite to the show, and we're really excited to have Margaret Hill on. Margaret, welcome to the show.
Well, thank you for having me.
So an IP, how did you get that fancy schmancy name?
Well, it's funny. When I first started out in infection prevention, we were just called nurse epidemiologists.
Oh, that's even worse.
And then, yeah. And then they changed us to infection preventionists. I think it's because we really do focus on prevention of infection more than just finding out where it came from. We want to prevent it from happening in the first place.
So you can prevent the infection, or when do you come into the process with patients?
Oh, well, I'm in the process from the beginning. So we start with staff in orientation. Mm-hmm. In Syosset, I am the infection preventionist. That's because, we're a small hospital. When I worked over in Long Island Jewish and Cohen's, they have a lot more people over there. There's about 8 of us over there at LIJ and Cohen's. But we all the system hospitals work, all the infection preventionists work. See, I even have trouble saying it.
That makes me feel a lot better. Thank you for doing that, Margaret.
We all work super closely together, and especially during these crazy times during the COVID-19 pandemic. So I'm very lucky to be part of such a great health system as Northwell, where I have so many resources.
Yeah. So your department, your program does what? Tell us a little bit about your program.
So, I'm under quality, and I start with, as I said, with the staff during orientation. We train staff on everything from, hand hygiene to cleaning equipment to using the proper disinfectants to cleaning.
This is to keep the hospital staff safe.
Correct.
Oh. We
also are in keeping the patients and visitors, family members, everybody else safe, also preventing any spreads of infection. So, we make sure that they're cleaning the operating rooms correctly so that somebody doesn't develop a surgical site infection.
So help us understand. I'm sorry. Go ahead.
No, I was going to say also we're hands-on with patients, families, and staff members, mostly staff members.
And you help patients and family members learn more about how to keep themselves safe?
Correct.
Yeah.
So when I worked over at Cohen's, I used to work mostly with the pediatric oncology patients. So my specialty over at Cohen's, I was part of the Children's Hospital Association. I learned a tremendous amount of how the children that had cancer can prevent themselves from getting central line infections, how to care for their central lines. So I did education with the nurses there and the patients, well, more the family members, because they would go home with these lines. Where with the adults, you're dealing with the patients, in Syosset, we don't have pediatrics. So I'm going in, helping with the patients directly if they have any kind of questions on whatever it is that's going on with them.
Yeah. Well, I'm a hand sanitizer carrier for decades now, so I've always done that. And my kids used to laugh because we would go on vacation, and I would always have wipes with me and Lysol. And whenever we went into hotels, I'm like, don't touch anything, and I would Lysol down everything first before we even went in, even in nice hotels.
Yeah. That's me from way back.
Yeah. I would work really well in your department. So how does Northwell help patients keep safe? What's the protocols that you put into place? Help our listeners understand, what Northwell does, because I think it's a great organization that really is a very long-term, thoughtful, futuristic, thoughtful, and really paving paths that haven't been paved before.
Yeah, so you have to agree with that. It's a pleasure working at Northwell and in my position right now. During this pandemic time, during these crazy times, it was all up in the air. Nobody really even knew what we were doing in the beginning. February, March of last year, this was all new to us, and Northwell was right on the forefront of making sure that we had everything that we needed so that the staff were safe, so that we could do the right thing to take care of our patients, to keep our patients safe. We started with monitoring of anybody who came in through our emergency room, anybody scheduling for surgery, anybody coming in the front door. We monitor do temperature monitoring of all patients, visitors, everybody who comes through the building. Staff do temperature monitoring every single day. And we also fill out a questionnaire every day.
Right.
The questionnaire is a simple questionnaire that asks about how are you feeling, basic things. Because you'd be surprised. People think, I just have a headache. It's not a big deal. But when you hit that yes on that questionnaire, now somebody's going to contact you from Northwell Health, from Employee Services, and review that with you. So we're really on the forefront of prevention. And that's a wonderful thing about working for Northwell Health.
Yeah. And I love what you said, that you love what you do, and it's not a job, but it's your passion, your calling.
Yeah.
I think that is so beautiful that you love what you do and you love telling stories and educating people. And that's something I know also through speaking to many of the doctors and nurses and professionals from the Northwell Health System, that education is also important. And it really is. That empowers us as patients, as individuals. If we understand what we're supposed to do, if we understand what we're going through, if we understand how we can prevent something, it just makes our lives better and maybe less visits to the hospital, right?
100%. And it's all, a lot of it is about prevention. And that's why when you laugh about, they call us infection preventionists, but it's all about the prevention. What can we do? If it's for something as simple as I'm going to go for surgery, what can I do before I go for surgery? I have to make sure that I clean my body before I go in for surgery.
Yeah.
I have to make sure if I'm diabetic, my sugar is under control. All these things are so important, and that's why the education is so important.
And how long have you been doing this education again? Over 7 years, did you say?
Well, in infection prevention, I think I'm about 10 years now.
Wow.
I'm at Syosset, and I'm coming on my 5th year, I believe.
Right.
Yeah, it doesn't even feel like I'm here that long. It feels like it's only a minute. I really do love working at Syosset Hospital.
Right. Do you get involved with the vaccinations and things like that?
Well, I work very closely with employee health, so we do a lot of educating. We go around to all the different staff. We educate on why we support the vaccine. It's funny because many staff ask me, are you getting vaccinated? And, of course, I did. I got vaccinated as soon as I was able to, which was in December. I got the Moderna vaccine right over here at Plainview Hospital. They make it so simple for us through Northwell. They have it so available for us that we can all get it. So Employee Health, Connie, whose office is right down the block from mine, we go around, we set up tables. Other administration, all going around, educating, because we really feel so strongly that our staff needs to be vaccinated to take care of themselves, take care of their families, take care of our patients.
So that's the question that I have for you that I was asked when preparing for this interview. And a lot of people, I went out and I get some information and I ask other people what do they want to know, what our listeners want to know. So many people want to know, what would you say to people who are not for the vaccination?
Well, I get that question actually quite a lot. And I say that the COVID-19 vaccines are effective at keeping us from getting and spreading the virus. They help people around you. You're not only helping yourself, you're helping your family members, especially if you have somebody who may be immunocompromised, elderly, somebody who has just recently had a baby. These are the people we really need to protect. And COVID-19 is still a threat to unvaccinated people. It is still here. You know, the variants that we're now seeing, we hear a lot about the Delta variant. I was on a call right before this where they were discussing the new Delta positive variant.
Okay, what does that mean? You need to dumb it down for us.
Yeah, it's a new additional variant that's a protein that's added to the Delta. So the Delta has already changed.
And what do you mean by the Delta has changed? The makeup of the particular...
Variant, so the different variants, the COVID-19 vaccines, vaccines are a wonderful thing. They change so that they can make you sick, even though we have learned how to take care of them. So we use the Greek alphabet, so now we're up to Delta. So the Delta variant is what we're now seeing, the prominent variant we're seeing now. And I'm sorry, my phone just rang. I'm just turning it off. Is the variant we're seeing right now, and that's the variant that we're seeing that mainly through unvaccinated people. And studies have shown that people who have received the vaccine in the United States are immune to the Delta variant. Well, I shouldn't say immune. No vaccine is 100% effective.
Correct. But 94% is the maximum of any vaccine.
So there is a slight chance you could still get it, but you're not going to get seriously ill. You're not going to die.
So how do we know that? Like, where are the stats? Because it's so new. It's not FDA approved. That's one of the questions I kept getting. It's not approved. It hasn't gone through the normal processes that vaccines are supposed to go through, right? So where are we getting these stats from? I mean, people are talking in generic numbers, not you per se, but there are people out there talking, saying this is so effective. Well, based on what? What are the numbers? Because we're scientific people. Medical people are scientific. So where are these stats?
Right. Well, COVID-19 vaccines were developed using science. It's science that has been around for decades. They're not experimental and went through all the required stages of clinical trials.
When did that happen? Because that's not what the normal, that's not what the everyday person is understanding.
Well, because normally, in the past, I shouldn't say normally, in the past when we developed vaccines, so say when we developed measles, mumps, rubella.
And when you're talking you mean the pharmaceutical companies, right? Because Northwell Health does not develop vaccines. I want to be really clear on that. Northwell doesn't do it. You guys administer.
No, correct. We administer. We don't develop.
Correct.
But, it's all a matter of research. And in the past, things were done in stages. The one stage, you waited, you tested, you waited a certain amount of time, then you did the next stage. When the COVID-19 vaccines were developed, all these different stages were ongoing. All the different companies worked together. This had never happened before.
Right.
And the RNA-based vaccines, that research has been going on for years. From back in the days when SARS and MERS, those vaccines were, those illnesses were coming around, those viruses.
Oh, I remember SARS. SARS was devastating. We didn't keep numbers back then like we did now, but they were devastating. And it was major social media. So it wasn't as, I would say, known, if you will, as much as it was now because of the social media. Because now we combat, 24/7 social media, 24/7 news. So it really elevated and escalated the conversation about it. And it was nonstop because that's all the news talked about. Right?
Yes, that's correct.
So tell us a little. Let's unravel this a little bit for our listeners, because you speak in very technical scientific terms, and we all aren't scientific. No, it's okay. So I'm going to unravel it and help us all understand. So you said RNA research. What is that? Slowly explain that to us.
Okay, so the Moderna and the Pfizer vaccines are RNA based. Okay,
and what does that mean? RNA.
So that's like on our cell, the ribonucleic acid on our cell. Uh-huh. The scientists use the newest of science. I'm not a physician.
That's okay.
They use the newest things. Research providers growing evidence that mRNA COVID-19 vaccines offer a similar protection in real world as in the lab.
Okay.
So these vaccines are effective at keeping us from getting and spreading the virus that causes COVID-19.
So let me ask you another question.
Yeah, go ahead.
I get that. Let me ask you a question. So I understand in Eastern medicine, because I'm actually a certified herbalist. In Eastern medicine, like cures like. It's a standard protocol. So if you get a bee sting, if you take that bee and it's dead now because it stung you, and you put it on the bee sting, it'll actually cure the bee sting. Not cure it, but it will make the bee sting better, and it will have that affectation. So with something like a vaccine, like cures like, so are they injecting pieces, separated pieces, so it's not as volatile, pieces of the COVID infection in the vaccine, or are they doing other methodologies? So are they doing like cures like?
Yeah, it's RNA based on COVID-19, the virus of COVID-19. So none of the COVID-19 vaccines contain the live virus. None of them.
Okay, so how does that work?
That's really a very good question.
I liked it. Thank you. It was actually one of the questions that came into me is like, how does that work then?
So our cells encompass the RNA or surround the DNA. Mm-hmm. So people are afraid. A lot of the questions I get are, is the vaccine going to alter my DNA? And that's not how it works. The vaccine materials never enter the nucleus of the cell. And the nucleus of the cell is where the DNA are.
And how do we know this?
So based on science and research and testing, and they say that the vaccine on the outside of our cells is almost like little tags on the outside. Mm-hmm. So the vaccine touches one of those little tags, and the little tag reacts. Our body reacts to that. Well, says, this is not supposed to be here.
And that's a question I have for you, because I know our human body is amazing and is self-healing. Yep. So every time there's like a cold, you get a cold, but you can only get that type of cold once, because our body goes, oh, I know this. This is not good. I'm going to do this to protect the body. And the body, the body adapts, and humans, the species, is incredibly adaptable. If you go back in time, we used to not stand straight. Now we stand straight because our environment requires it. Now we're finding a lot of people hunching because we're spending so much time over computers and our small screens and things like that. So our bodies start to morph and adapt based on our situation. Similar to if I live up in the north and I'm used to being in the cold, my body adapts. When I go down south, I'm dying of the cold, but then eventually I'm very affected by cold because now I'm adapted to the hot water. The hot weather, right? So one of the questions that came into me is if someone gets a vaccine, they're protected, at least up to 94% protected.
Right.
Why is it that people who are not taking the vaccine, why are vaccinated people so upset with the non-vaccinated people if that's their choice?
Well, I think the main reason is because we're trying to reach herd immunity. And herd immunity is when we reach the percentage of the population that are vaccinated so that we see a tremendous drop in the virus. Because the virus needs people to be hosts. They need us. I'm vaccinated, but they need unvaccinated people so that they could go into your body, mutate, and make us sick. That's what their job is.
Understood, and our bodies adapt to it. So our bodies will learn to fight it off, right? So what, vaccinated or non-vaccinated, our bodies, the strong ones. So that's why the people who are have immune deficiencies and things like that, that's why they're really in danger, because they can't fight it off as well as other people can fight it off, vaccinated or non-vaccinated. Right. Yeah. So I understand that.
And the more that we have vaccinated, the less virus that's around. So there's a decrease in the viral load. Mm-hmm. That means there's a decreased chance of it mutating.
Got it. So I know that we've already hit the stats according to what they said in New York State, that we already did that. That's why we don't have to wear masks anymore. I'm intrigued as why some of the schools, not a question for you, but I'm intrigued at why some of the schools in the city are still having children who are the least likely to get this wearing masks still. So that's always an interesting conversation, not for today, but an interesting conversation relative to not needing to wear masks. So we hit herd capacity, if you will. I really appreciate the whole explanation on the RNA, because that had me totally perplexed. I'm like, how does this work? Why does it, and nobody really answers those questions. So I appreciate your knowledge on that, Margaret. Sorry if I put you a little bit on the hot seat, but our listeners really appreciate that. You are listening to Healthy Lifestyle with Lori Anne. We are going to be right back with Margaret because we want to hear more about her infection prevention programs that she does and her outreach all around our area. And I want you to just hang in there. We have a lot of information, and Margaret is a wealth of information and our educator. So thank you for holding on, and we will be right back. Well, welcome back to Healthy Lifestyle with Lori Anne. Did you miss me? Okay, I don't know. So if you have any questions or comments or concerns, please reach out to us at healthylifestylewithla@gmail.com. Or, of course, follow us on social media. I know some of you are right now waving at Healthy Lifestyle with LA. We're on Facebook, Instagram. You can find us out there. We're all over the place, including right here, right now. We are having a great conversation, learning so much from the great, amazing Margaret Hill. She is so full of knowledge, and it's just so helpful. I love these conversations. We can speak about all kinds of topics for a very long time. So because of time, I need to kind of push to the next one. So Margaret, you wonderful, beautiful human being, you are giving back to your community, right? And how are you doing that?
Well, it's a big thing that we do with at Northwell Health is giving back to the community. And one of the things that I love to do is, using my infection prevention knowledge, is go out and do a mobile flu vaccination. So I'm one of the people who goes onto the bus that goes around, and we go into different areas. I recently, last year, actually, I think it was in October or November, I went with a few other of the nurses here, and we went on the bus to Freeport, to the Freeport Rec Center, and administered vaccines to many, many people. And at that time, it was at the time when we still had many, many questions about all the different things that were going on. So as I'm giving out the vaccines, I also like to educate people. So that's something that I love to do. I also love to go into schools.
You do career days, don't you, and help people?
I do career days.
Yeah, you're known for, our great Margaret here today is known for her work with the community, helping young adults find their career paths. And let's talk about those different career paths that are available to our youth. Real important career to go into is, we talk about this a lot, Margaret, on our show here at Healthy Lifestyle with Lori Anne. We talk about the fact that we're here to do two things as humans. We're here to learn something. There are lessons we need to learn as humans, but also we're here to serve other people. And you're in the business for serving other people in the healthcare community, right?
Correct. I am.
So what kind of job opportunities, career opportunities does our youth have? The people listening, do they have available to them?
Well, there are so many opportunities in healthcare. I specifically speak of all the different opportunities I've had in nursing. You spoke of in the beginning of the show, I went from working as a staff nurse on a medical unit. I worked in a long-term care facility as a supervisor. I worked in a school. I was a one-to-one nurse in a school.
You were a school nurse?
So much available. I was actually with one child. It was a child that had a trach. So he needed a one-to-one nurse. That was a lot of fun. I did that for a little bit over a year. I did it when my child was born, and it really worked out very well for me.
Yeah.
I think nursing is so flexible.
Yeah, it really is flexible, because look at all the different jobs you've held, different careers you've held in your nursing career. That is so cool. You must have loved going through all the classes with them, right?
Oh, yeah, I did. I absolutely loved it. It was a lot of fun. And, you had the responsibility, of course, of taking care of the child. That's yours. But I became very good friends with the family and still am in contact with them.
Oh,
so it was very interesting.
And how long did you do that?
I only did it for 2 years, and then I actually missed the hospital so much, I went back to the hospital.
And what was it that you missed about the hospital?
I just really love working. When I work in medicine, so that's anybody who generally goes into a hospital, an adult, for a medical procedure, not a surgical procedure, that isn't sick enough to have to go to an intensive care unit. Mm-hmm. So that's really everybody. You take a good percentage of the elderly, you take care of patients, took care of a lot of cancer patients. And when I first started out, patients were in the hospital a long time. Now it's a very fast-moving process because, you can get infections in the hospital. We want you home. We want you to take care of you at home. But I've made some of the best friends I'll ever have when I worked in the hospital. I still have wonderful friends that I started out in nursing school in the 80s. Nursing has progressed so much over the years, and it's a profession. It's not a job.
You know what I notice about this profession? More and more men are nurses. Like a lot more men are nurses.
Definitely. And men are wonderful in nursing. I love working with men.
Oh my gosh, yeah. Most of the ones that I've ever interacted with, they're hysterical too. Well, most of the nursing staff. I would suspect with the amount of hours that you put in and the people that you're helping and the type of people that are nurses, that's why they always have this great sense of humor. You need a sense of humor when you're in
that's true.
in these kind of conditions, because sometimes the emergencies come in and you really focus on everything that's going on, take care of the patient, and then that gives you an opportunity for a little levity. So some of the largest laughs I've ever had were for some of the nurses who were taking care of me at the time, and they would just make me just giggle through the whole thing, and it just changes everything. It makes the whole experience better. It's uncomfortable to be in a hospital to begin with, but then when you have a beautiful nursing staff helping you out and there for you, it just makes it better. And again, kudos go out to all of you in the profession who took care of people during the pandemic, because you were there and you were the family, because we couldn't get to our family members.
Yes.
And so
it was a very difficult time for us also, because we had to be the family members for people who were very, very ill. And it was, we used FaceTime and phones and anything that we could. And it was very hard on everybody.
Yeah. I thought it was really, miraculous, the amount of technology that was used, that you did do the FaceTiming, that you allowed the families to be talking to them, but that required you guys to have even more responsibility and jobs to do. So again, on behalf of the community, we're so grateful for what you do and what everybody does in the hospital, and how everybody took care of our family members, our friends, our neighbors, our business associates. So we're really grateful for everything that you do. So tell me this, you have a very interesting thing here that I noticed, is you volunteer with your English bulldog at the Dog Ability Center. Talk to me about that.
Well, I actually learned about them from Syosset Hospital. Christine, who runs all of all the organizations at Syosset, got me in touch with the Dog Ability Center in Syosset. And I started bringing my English bulldog there. I think it's about 2 years ago now. Unfortunately, they're closed now. They haven't reopened after COVID. But you go and you get training, and it's really very intense training. We would go once a week for training, and then we would volunteer at least 3 times a month. That was your commitment. And we became AKC certified. We only finished the first 2 steps. We still have to keep on going. But, he's a joy, my English bulldog. You could ask anybody.
Aww.
And we did a lot of adults with learning disabilities, special needs, adults, special needs children, people who lived in group homes would come. It was all at the center. We didn't go to places, but we did fear of dogs, children or even adults that had fear of dogs. And I learned so much through that, and I absolutely adore it, and I hope really soon that we can get back to doing it again.
Oh, my goodness. You really are an angel on earth. That is a great program. That must be so joyous. I love what I do. I'm a life and business strategist and mentor, and I love what I do. I love helping people find their purpose and figure out how to set up a nice, strong foundation for what they want to do, what their purpose is, what their dream is, what their business is. I love doing that every day. But what you do is just, totally out of the realm for me, because I can't even imagine. Well, that passing out thing doesn't help either. But but being able to do that is just, you're such a kind soul, and you can hear it in your voice, and you can hear the love of what you do in how you talk about it. It's beautiful. It really is, Margaret. You should be very proud of yourself. I'm sure you are. It's a real honor to speak to you today. It's just amazing. So let me ask you this question. I ask all my guests this question is, what's your why? Why do you do what you do?
I feel like it's just a part of me. It's who I was raised to be. I was one of 5 children. My parents very, involved in the church, and it was always about giving back. My mother was always volunteering and bringing us with her when she volunteered and did various things. I remember when I was very young, and my mother was volunteering in a nursing home, and she brought me with her. And at first, I was terrified of who are these people reaching out to me. But my mother was a very smart woman and educated us on what this is a part of life. And I think that really shaped me, made me who I am. I was very lucky. I grew up in a house with religion, and I was taught about giving back to the community and the importance of it.
Yeah. Oh my gosh, that's a beautiful why. That really is. So what's on the program docket for Syosset Hospital and Northwell Health this year?
Well, right now we're just getting back to normal, I guess I should try to say. Continue to encourage people to get vaccinated. We are really fully operational right now at Syosset Hospital. We have an extremely low admitted COVID patient rate throughout the health system right now. Unfortunately, we are starting to see a little bit of an uptake in the community, but we're keeping a close eye on that. We do work very closely with the Department of Health and, keep an eye on everything that's going on. We report every day all our numbers and everything. In the future, what are we going to continue to do? Right now, I think the big thing that Northwell Health is focusing on is caring for their staff and making sure that we're all okay after everything that we went through. And that's another wonderful thing that they provide. For me personally, I joined the Center for Weight Management at Syosset because I had put some weight on during COVID. Everyone was feeding us. It was free. I had to eat it.
It was a rule. You were being polite. That it just sounds like you, Margaret.
But there's so much that they provide for us. You can, if you're shy and you don't want to go talk with somebody in person, you can do it on your phone. You can do it. You can do it through voicemail. What is the word I'm looking for? Like a web call. There's so much that.
Like a Zoom call and things like that.
Zoom call,
yeah, virtual calls. Yep.
So much to go off of the as I know that you spoke with Cynthia about it on another call about Code Lavender.
Yes,
we're overwhelmed and something happens. I mean, that's a fantastic thing that they have that they offer in Northwell Health. And as I said, I'm so blessed that I'm a part of Northwell for the amazing infection prevention team that we have. Our leader, Donna Amelino, who's the vice president for the health system for infection prevention. She is fantastic. We had calls every week. We continue to speak regularly. So there's so much that I'm grateful for from being in this health system.
That's amazing. So what is something else you're most passionate about in what you do?
I'm passionate about really being honest with my staff, my patients, and telling them this is like, why do I have to wash my hands? Well, after COVID, they kind of figured out why they have to wash their hands. But, I'm passionate about the reason why I do this. I'm doing this because I'm trying to protect you, and I'm trying to protect our patients and our family members and protect our community. And that's really what it's all about, the safety of us all.
I can't agree more. We need to take care of each other. It's on so many levels. You just need to be kind to one another, take care of each other. That's what we're supposed to do. We're supposed to provide service to other people. And honestly, when you're having a bad day, I know I've said this before, but I'll say it again. When you're having a bad day, take yourself outside of your head, outside of where you are. Go do something nice for someone else. It will make you feel so much better. And I bet you it'll put your bad day back in perspective. One thing I was taught when I was growing up, and there were many reasons, but one thing I was taught when I was growing up was that there are always other people in far worse situation than you are at that particular moment. And you may not think so, but you got to really believe it, that there are people that are suffering far greater than what an individual's going through at that particular time. Not to minimize what you're going through, but to just put it in perspective. Sometimes we just have to put things in perspective and do things out of the safety for other people and do things out of being respectful for other people. And that's respecting each other's wishes of whatever choices they make in their lives. They need to make the choices. They're on their own journey. We have to remember that we're all on this journey. And when we touch other people's lives, we have to be mindful of the fact that we're touching other people's lives, but then we also have to be mindful of the fact that we're on our own journey as well, don't you think?
Yes, I agree with you 100%.
Yeah, it's fun to go through the whole thing. And Northwell is really mindful of education. They have all these fantastic programs available out there for the community. And I love speaking to all of you professionals from Northwell. The professionals all come in here and basically have that same mantra that comes from Northwell, which is they truly, deeply, individually want to make a positive impact, and they want to educate and empower the patients, and they want to look at the patients holistically, so it's not just a body part. Because I remember the days when we used to feel like that we weren't cared about. It was just, if it was a risk doctor, they would just look at the risk and they wouldn't care about who we were, what we were about. And that's no longer, at least not in the Northwell health system. That's what I've observed time and time again. And you're another good example, great representative of the system of health, Northwell. Amazing, just amazing, Margaret. You're just so powerful in how you speak and so powerful in the messaging that you get out there. So you must be an amazing educator for the staff over there. And I bet you they love you to death.
I love them.
That's probably why you got so many treats, and now you need to go on the weight loss program. It's good. Well, you all deserved everything, all the support that you get. I'm glad that finally, I used to, I don't know if you remember, you're probably not old enough, but when I was little, I wanted to be a nurse until I found out I did that passing out thing. But I wanted to be a nurse. So I was a candy striper for years. And then I read the cherry. Oh, yes. Yep. I was a candy striper in Huntington Hospital for years. I was even on the candy striper council. I had my little, what looked like a nurse's hat, but it had stripes on it. And I just wanted that hat. So I was like, I'm putting so many hours in to be on the council, because only the council people got that little nurse's cap. And do you remember Cherry Ames, the books? It was Cherry Ames was it was a book about a nurse. I love that series so much as a kid. I was reading that along with my Nancy Drews. And
I do know Nancy Drews.
Yep. But Cherry Ames was a nurse, and she went through, getting her nursing degree and the whole 9 yards. And I remember that, and I was really on track to become a nurse. And then I found out that really wasn't my bailiwick. That wasn't my wheelhouse. So I had to change direction. But so I have great admiration in that you're being really represented, and you're being acknowledged for all the work that's being done in the healthcare system, and how all of you take care of us so well. We really do appreciate you. And I hope you feel appreciated, because we do appreciate everything that's done. You're our go-to person when we're in our biggest panic. I don't know what to do. Yeah. And to be able to educate us.
Saying that.
Well, it's true. It's so true. And to be able to educate us and teach us how to, and empower us with knowledge is just a gift that you give to each and every one of us. So thank you so much for what you do. Again, Margaret Hill, she's an RN, Infection Prevention Program Director. And you are an infection preventalist, right? Preventionist. You know, I have a friend who, he's a business associate, and he came in and he said that he was a utilityologist. And I'm like, what the heck is that? He actually saves you money on utilities. If you have a big company and you have warehouse space and stuff like that, he actually saves money. He goes in there, no cost to you, and he saves money. But he calls himself a utilityologist. It took me months to be able to say his title. And he made it up. He totally made it up. So I told him that he somehow must have had something to do with burgerology or something like that. So I love that you came on the show. Any last thoughts?
I just want to thank you for having me on, and thank everyone out there for all the support that they've given us over the last year and a half now.
Yeah.
And, I hope it continues, that everyone continues to, you wash your hands and clean your equipment and prevent infections.
Yes, ma'am. I'm reaching right now. I'm going to put a little bit of my hand sanitizer on because I'm not where I got my little thieves hand sanitizer. So I'm going to put that on right now as I say thank you to everybody for tuning in this week. And thank you for joining us on Healthy Lifestyle with Lori Anne. It is always so wonderful for me. It lifts my heart up to be able to share this time with you and bring great people like Margaret Hill from Northwell Health to you to help educate you, give you more information, give you a little taste and a touch of what's out there and available to you. If you want more information, of course, contact us at Healthy Lifestyle with Lori Anne or healthylifestylewithla@gmail.com. And again, I want to thank our guest today, which was Margaret Hill, and remind you, we are here to serve one another. So please take a moment, step out of your day, and do a little something for someone else. It will make you feel really good. Anyway, have a really good day. Thank you for joining us on Healthy Lifestyle with Lori Anne. I am Lori Anne Casdia. Until next time, play a higher role, serve a higher purpose, show up for you, and show up what, Michael?
Big.
Nice. Show up big. Have a great weekend.